Now we come on to the muscles of the pectoral region. First, the pectoralis major. It is a spiral type of muscle having a vast and continuous origin and forms a U-shaped tendon with unequal limbs. As regard its origin, it has got a vast origin. Number one, from medial two-thirds of the anterior surface of clavicle. Number two, half of the anterior surface of the manubrium and body of the sternum down to 6 costal cartilage. Second to 6 costal cartilages and sternal end of the 6th rib. Fourth, aponeurosis of the external oblique and rectus sheath of the abdomen. The fibers of pectoralis major form two laminae. First lamina comes from clavicle and manubrium in the shape of a thick muscle mass. These fibers travel downwards and laterally and form the anterior lamina of the tendon. The remaining fibers are thin and longer. They pass upwards and laterally. They twist around the lower border of the lamina, producing the anterior axillary fold, and ultimately form the posterior lamina of the tendon. As regard the insertion, both lamina form a bilaminar U-shaped tendon which is attached to the lateral lip of intertubercular sulcus. The fibers which originate from the rectus sheath of the abdomen are the longest in the posterior lamina, and they may reach up to the shoulder joint. Pectoralis major is innervated by lateral pectoral and medial pectoral nerves from the cords of the brachial plexus. As regard the action of the muscle, when we consider muscle as a whole, it causes flexion, adduction, and medial rotation of the arm. Clavicular part in isolation are responsible for flexion of the extended arm, and sternocostal fibers are responsible for extension of the flexed arm, and they assist latissimus dorsi in climbing. As this muscle covers a large area, there are so many structures which are present underneath this muscle. These structures are: number one, bones and cartilages, sternum, ribs and cartilages. As regard the fascia, clavipectoral fascia, subclavius, pectoralis minor, serratus anterior, intercostals, and upper part of biceps and coracobrachialis muscles. As regard the vessels, axillary artery and its branches, axillary vein and its tributaries, and cords of the brachial plexus. Now we come on to the clinical anatomy. First, the deltopectoral groove. It is an indentation between the deltoid and the pectoralis major muscles. The cephalic vein ascends and travels in it. It pierces clavipectoral fascia in the subclavicular triangle to open into the axillary vein. During radical mastectomy, removal of the breast and underlying muscles and related lymph nodes, the sternal head of the pectoralis major is removed. The clavicular head is kept intact with the view to preserve the cephalic vein. Notable point in this process is that surprisingly, the functional loss after removal of the sternocostal head alone is less and cosmetic defect nil as compared to the removal of sternal head of the pectoralis major muscle. Second muscle of the region is serratus anterior muscle, which is present as a large flattened sheet of muscle mass which curves around the thorax and have got extensive costal and scapular attachments. It has got 8 fleshy digitations which originate from outer surface of upper 8 ribs close to the anterior angle plus intervening fascia covering the intercostal muscles. First digitation originate from first and second ribs, whereas lower part of the muscle interdigitate with the upper 5 slips of the external oblique muscle of the abdomen close to the anterior angle. The muscle fibers of the serratus anterior follow the contour of the chest wall closely. That is, they wrap the chest wall. They pass lateral, posterior, and medially in front of the muscles attached at lateral border of the scapula and subscapularis, and ultimately reach the medial border of the scapula. Serratus anterior muscle is inserted along the medial border of the scapula on the costal surface. First digit is larger and is inserted from superior angle to root of the spine. Next two digits, that is second and third digits, are attached from root of the spine to the inferior angle of scapula, whereas the remaining 5 digits are attached on a large triangular area on the costal surface of the inferior angle. Serratus anterior is innervated by long thoracic nerve which descends on its outer aspect. As regards the actions of the muscle, it causes protraction with pectoralis minor. Its fibers attached at inferior angle cause rotation of the scapula, and this action is helped by the trapezius as well. Serratus anterior steadies scapula during weight carrying, and it helps in forced inspiration, and it keeps medial border of the scapula against the chest wall. If this muscle is paralyzed, winging of the scapula, that is prominent medial border of the scapula, occurs. Pectoralis minor muscle is present as a thin triangular muscle sheath deep to pectoralis major. It originates from upper margin and outer surface of third, fourth, and fifth ribs near costochondral junction, and in addition from fascia overlying intervening intercostal muscles. The muscle fibers of pectoralis minor ascend laterally under cover of pectoralis major and converge into a flattened tendon, which is inserted onto the medial border and upper surface of the coracoid process. Pectoralis minor is innervated by lateral and medial pectoral nerves. As regard the actions of the pectoralis minor, it causes protraction of the scapula along with serratus anterior and depression of the shoulder along with levator scapulae and rhomboides. It resists scapular rotation attempted by trapezius, and finally it helps in forced inspiration. The fourth, subclavius muscle, It is a long asymmetric triangular muscle present deep to pectoralis major and extends between clavicle and first rib. It originates from first rib close to costochondral junction as a thick tendon. Muscle fibers pass upward and laterally, and lower and most lateral fibers are the longest one. These fibers are inserted as fleshy fibers into the subclavian groove. Subclavius is innervated by nerve to subclavius, a branch from superior trunk of the brachial plexus. As regards the actions of the subclavius, it steadies clavicle, resists accelerated elevation and rotation of clavicle during elevation of shoulder girdle, provides a cushion for the axillary vessels and divisions of the brachial plexus. Comments and suggestions will be welcomed. Thank you for listening and watching.